Welcome back. This is Ken 355, Ethics in Physical Activity and Health. Today's topic is going to be ethical practices and research topics. So, where we are right now in the session is we've kind of wrapped up our initial introductory definitions of ethics, thought about some ways to frame decision making. And we have talked about historical cases, which have then led to the development of codes of ethics and laws, federal laws. So, this set of lecture slides is really all about how these documents apply to what we actually do in kind of real life, if you will. So, like I said, these documents exist, these codes of ethics, these laws, they're federal, so we have to follow them. And so this is kind of what it looks like on the ground, if you will. So if you'll remember the Belmont Report, it was that kind of landmark document that laid out the three basic ethical principles when you are working with humans. Now, this was specifically related to research because of those historical cases that were very troubling and quite unethical. So the three basic ethical principles are respect, beneficence, and justice. What respect really means and what the further details, if you will, of the Belmont Report lay out is that respect means that you are treating people as autonomous agents. So what that means is if somebody has autonomy, that they can make decisions for themselves. So when you respect somebody, you treat them as an autonomous agent. And then further, those with diminished autonomy, meaning individuals who have perhaps mental disabilities or children, would be considered not autonomous until they reach adulthood. Those with diminished autonomy are entitled to additional protection. So respect, like I said, if you treat someone as an autonomous agent, then individuals are entitled to their own opinion and goals. Of course, this is unless detrimental to others, because as soon as you start harming others, then you wade into, illegal activity sometimes, if you're hurting someone, if you're stealing from somebody. Obviously, those would be detrimental to others and not only considered potentially unethical, but probably also illegal. So you can have your own opinions and goals, but you shouldn't be hurting others. Respect also means that you should only be enrolling individuals in research who choose to do so. So they're doing this voluntarily. You should be also providing adequate information about what you're doing, the study, the trial, and the individual should be told all the risks and benefits that you can think of by participating in this research study, and then they are able to fully give their consent for participation. Beneficence, remember the easiest way, I'm going to sneeze. Bless me. So anyways, remember this is a live capture. I don't edit this. I just kind of chat over. So apologies, but this is real life. Anyways, beneficence is, the easiest way to sum this up was do no harm. And really what you're doing here then is you're making efforts to secure the well-being of individuals. So this is do no harm. And really, when you are doing research, you should be minimizing possible harm. Certainly, there will be risks in any research that someone undertakes, and you should be doing as much as you can as the researcher to minimize those possible risks, and then you're going to maximize possible benefits when available. Justice would be kind of fairness, if you will, if you want to think of it that way. And so classically, the Tuskegee study was considered unjust. And that's because, an injustice, for example, occurs when some benefit to which a person is entitled is denied without good reason, or when some burden is imposed unduly. So with the Tuskegee study, remember, in 1945, when penicillin was found to be an effective treatment for syphilis, they did not administer that, excuse me, to these study participants, and they actually continued on with the original study as they had designed beginning in 1932. So that is a good example of a research study that's considered unjust. So further, if we think about these respect, beneficence, and justice ethical principles, then what do we do? Well, if we respect these autonomous agents and we give them all of the information that they need before deciding to participate, and they voluntarily participate, what we would ask from them is informed consent. So again, given all the information, they agree to participate, and they tell you, yes, I've been told all this information and I agree to participate. So that would be a application of the respect principle. For beneficence, you would a good example of an application of that is assessing risks and benefits. So the riskier the research is, typically the more benefits it should have. So if you are doing some kind of trial with medications or something like that, if you think there's going to be a lot of side effects, it better be a potentially very, very, very good drug. But in other cases, the risks and the benefits may be relatively smaller in nature. So for example, I'll show you later a consent form where, people who are participating in a walking program, which is pretty low risk, are told that, and the benefits they get is being more active. So you assess those risks and benefits, but you do no harm. So the benefits need to outweigh the risks. And then selection of subjects is a great example or an application of justice, because you want to be as fair as possible when you are conducting research. So as far as codes of conduct go, these are not federal laws, but essentially any association or organization has a code of conduct. You're going to read one for the ACSM. So if you're a certified professional for the American College of Sports Medicine, Section F of their handbook, if you will, talks about this code of conduct. The American Medical Association, I'm sure the American Physical Therapy Association has one, and the National Institutes of Health, the NIH, which is the governmental office that houses all of our health and human services offices, has guidelines that most associations incorporate. So meaning that they have 7 principles that they say research should follow if it is considered ethical research. So based on the 7 principles, or the 7 principles are social value, we'll talk about each of them, scientific validity, fair subject selection, favorable risk to benefit ratio, independent review, informed consent, and respect for enrolled subjects. So you can see here how the Belmont report is overlapping with these guidelines already, just in these bullet points. But you'll see more as we go along. Again, this is the NIH's principles, but the NIH says that if you're going to do research that has humans involved, especially, then that study should really be, in some shape or form, the goal should be to improve people's health or well-being. And of course, we're talking about health research here. So yes, humans are used in lots of different research, but health, wellness, and medicine, we use humans a lot. So if a research project doesn't have social value, it doesn't improve the lives of individuals, then really a lot of people think that's just a waste of time and money. Why would you do something if it's not going to benefit society? So that's why, social value here. And then it also includes sharing results, which we call dissemination of results. So if you do a research project, you should be putting the results out there for people to see. Scientific validity states that research should produce useful results and increase knowledge. And good research follows the scientific method, the same thing that we've talked about since probably fourth grade. Obviously, here is a multi-step process that really, or a plan, in which you are answering a specific research question. And so you're making a hypothesis. You're trying to control variables as much as possible. And doing good statistical analysis and presenting the results as they are. You try to avoid bias. Certainly we all have a bias. For example, we probably all think that physical activity is good for you, and I think that that is true. So you have to be mindful of that when you're doing research, because if you have a research project that says, this would be weird, but physical activity is not good for you, then you might be a little bit worried about releasing those results. And so that's why we really want to follow the scientific method here. And you're going to really try to avoid bias when you can. It is what it is, often I say. You do a research project and the results are the results. The next principle is fair subject selection. So you want to have fairness in recruitment and who can participate. Because sometimes research really does benefit participants directly. For instance, drug trials. There are lots of times when, cancer patients, for instance, they'll do clinical trials and they may have some really favorable results. So it's really important then that you try to do your best to be as fair as possible when you're talking about participation. Research studies, if you're participating in one, sometimes they can be difficult. They can be strenuous, they can be time-consuming, they can be challenging, if you're asking someone to change behavior or diet or whatever it might be. So you want to pick people will do everything right. That's not exactly the best thing to do. Okay, so this bullet point, it reads a little bit like you should pick people will do everything right. That's not necessarily the case. You really should be picking subjects from a wide variety of, depending on the research project, a wide variety of walks of life, so you can actually make some conclusions that are worthwhile. You want to have also a favorable risk to benefit ratio, which means that favorable meaning that the benefits outweigh the risks. So as I already mentioned earlier, if you have something that's risky, then the benefits need to be pretty great. So any risk must be balanced by benefits to the subject or new knowledge that we will gain from that research project. So the riskier the research, the more benefits it should show or potentially show. And then finally, we have our seventh principle here, which is respect for enrolled subjects, which obviously flat out same language as the Belmont Report. But here we also want to show respect by continuing to check the well-being of your participants, keeping their information confidential. Actually, you should be allowing subjects to quit a study at any time. If any new information becomes available, then you need to share that with them along the course of the study. For instance, the Tuskegee study being the biggest example of obviously new knowledge came to light. That should have been shared with the subjects right away. And then you respect your individuals also by sharing the results with them. So oftentimes after I get a publication published, I will often send that to the participants who participated in the research so that they can see how I used it and they can read about it and see kind of what happened. Because that's, if you participate in research, oftentimes you really do want to know, well, what happened and how did I kind of fit into that? Okay, so let's dive deeper into some of these topics here. Informed consent is absolutely an imperative ethical principle. So it's a major feature of almost any ethical guidelines for research. And what you do when you give informed consent or you ask for informed consent is that the participants or potential participants are told as much about the study as you can. Sometimes you can't tell them too much, but then essentially that they hear about what's going to happen and they say, yep, I will participate. Informed consent, though, has 4 components. Competence. So they have to be considered a competent adult to give informed consent. If you have a minor, minors, for instance, under the age of 18, of course, cannot give consent. Their parents have to give what we call assent because they're actually not considered autonomous agents yet. Individuals who are deemed incompetent cannot give informed consent. And participants can be deemed incompetent for, lots of reasons, but essentially they are no longer considered an autonomous agent. So they have to be competent. Disclosure, meaning that you have to disclose as much information as possible to your participants. Understanding, they need to show that they understand what is being told to them. This one's a little tricky because a lot of us sign things all the time and we don't read things. That's you want to make sure, or at least encourage your participants to really read the document before they sign it or agree to it. And then, of course, they're voluntarily participating. A lot of times when someone gives informed consent, they will sign a form, like in hard copy. But in our electronic world today, informed consent doesn't have to be written. Absolutely not. It can be electronic signature, or it can be some kind of action, like if they're doing an online survey, they can read the consent form and they can click to agree. If they click to agree and proceed with the questionnaire, then they have given informed consent. So, back in the day, or if you see people in person, like I did a research project last year where I saw people in person, they came in for appointments. So we certainly had them sign a form because that's probably the best way to do it, or at least the safest way to do it. But with electronic data collection now, like I said, it doesn't have to be a signed hard copy. You can do this a variety of ways. So with informed consent, when you have a informed consent form, then you need to include in it kind of what's going to happen, the nature of the treatment or the study, the risks, the benefits, if there are any alternatives, and allow for an opportunity for those individuals to ask questions. So let me show you an example here. This is an example of a research project that we did several years ago, actually. And so our informed consent form, in that first paragraph, it tells you what we were going to do. So they've been invited to participate by us, so myself and a student of mine that I worked closely with. And we told them what we were going to do. We were going to collect some measurements while they participated in a walking challenge that we have here on campus. That second one gives as much detail as possible. The third line, there's minimal risk to your health. We cannot guarantee that we receive any benefits from this study. Obviously, that's the risks and the benefits part. Any information that can be identified with you will remain confidential. And then, another few statements about prejudice, your future relations with CSU Monterey Bay. And you can withdraw your consent and discontinue participation at any time without penalty. So that's showing respect, allowing them to drop out whenever they feel that they want to. And then the opportunity for questions. If you have any questions, please ask. And then contact information if anything pops up later. Since this is a hard copy, they're going to be given a copy of this form to keep that we both sign. And then in bold there, you'll see you're making a decision whether or not to participate. Your signature indicates that you have decided to participate, having read all the information provided. So they are declaring that they are volunteering, or they're voluntarily participating after given all of this information. So that's how it would look, kind of like I said, in an example. Moving on then, another application of these documents is independent review. Before you do a research project, or I should say before you start collecting data, a group of people not connected to the research project will evaluate the details of the study and will approve it. And it'll get a classification based on the federal protection laws. So these groups of people are typically called institutional review boards, IRBs. Every university has one, every hospital has one, every research group has one. And so what happens is that individuals will, that want to conduct research, will fill out a pretty lengthy application. You can find the CSUMB one online. You fill out a pretty lengthy application that outlines all of the details of your study and potential risks and benefits and so on and so forth. And then this group of individuals reviews that. And what this group is going to do is make sure that your research study will fulfill the ethical considerations that we've been talking about, these 7 principles. Some other important concepts and issues in research, minimal risk. So we've kind of mentioned that. You really should be minimizing risk as much as possible. You don't want harm to come to your research participants when you could have prevented that. Payment. So payment is common in research because it does take time for individuals to do things. Oftentimes, if you're doing a study for several months, and the researcher may pay their individuals. So you just have to be careful that it can't be considered undue inducement, meaning the payment is so good that the individuals feel like they can't refuse or they can't drop out. So you have to be careful with that. Coercion, of course, coercion being, for lack of a better word, really convincing somebody in a way that is pretty aggressive. I don't want to say trickery, but perhaps skewing some important information in order for them to participate. So if you're coercing somebody to participate, you may not be disclosing a lot of information to them, or, like I said, aggressively recruiting them to participate. Exploitation would be then taking advantage of somebody. This is why in the Common Rule, prisoners are actually subpart C. So subpart C says prisoners have additional protections because they're actually easier to exploit. And that's true because, for instance, or I should say, an example of that would be, if you have prisoners, and they can participate in research. Prisoners participate in research all the time. But what you have to be careful of are things like payment and undue inducement. So a little bit of money outside of the prison system is usually not considered a big deal. A little bit of money inside the prison system can be very persuasive. Obviously, because they get paid a little bit to do some work. It's very, 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 very little. So if you're paying them to do something while they're in prison, you have to be very careful about that, right? Or exploiting them. Other things like data integrity. So especially with our electronic storage devices now, you absolutely have to take protections against data integrity. And then conflict of interest. So a conflict of interest would be, or I'll give you an example. So let's say you're doing research and you're doing genetic research. And you are working for a for-profit genetic company, let's say like these popular DNA kit companies, let's say you're doing both research for them and you're a paid employee of them. That would appear to be a conflict of interest, meaning you have a stake in if that research shows an effect or not. So for, like the genetics example, let's say you do a research project that says these things are totally ineffective, but you're a paid employee. So because of that, you decide, well, I'll kind of redo the results a little bit to make it not as bad. That is not okay to do in research, and that may have stemmed from your conflict of interest, right? So when you had a stake in those results, you can have a conflict of interest and still do research, but you have to declare it. And you may see that. So if you read a research project or a research paper, sometimes at the end, they will declare a conflict of interest. And what they're doing there is they're just saying, hey, I'm putting it out there that in this one example, I work for this company and I did the research on this. It makes it a little better. What would be best, of course, is if there were no conflicts of interest at all. So other things to think about with research. And I realize not all of us are going to do research, but it is really important to understand these processes behind them because clearly you will be carrying out a lot of things that stem from research. So you want to make sure that all this research is ethical and producing really good results. So let's kind of, that's like I said, more research related. And it's great to understand how ethical research happens since you will be reading research throughout your career. But now let's go to kind of the other side of that. So where you have like patient-provider relationships. So let's talk about some ethical standards for patient-provider relationships or client-provider relationships, because oftentimes you may be like a health coach and you won't call your person a patient, you'll call them your client. So when you have ethical standards when working with individuals, you really should be seeing them as an individual, as a person. I know that seems silly, but you are in health services, and that is a very personal thing. So it's very important to see that individual, as a person. Trust is really important. So establishing a foundation of trust is essential for any provider-patient relationship. And so your textbook lays out this really nice Seeing Red acronym, RED, which stands for respect, empathy, and dignity. And this is kind of like or a nice little guideline, if you will, or the values. If you follow these, then the seeing the individual as a person and a foundation of trust can potentially be built. So seeing red, if you're respecting your individuals, you are showing that person attention and regarding that person's feelings. A good example of this would be what we call often bedside manner. So there are some physicians that have great bedside manner. They really listen to their patients. They really take what they're saying and use that to provide the best care possible. And then other times we say that individuals don't have very good bedside manner. And so in those cases, it's obviously typically negative, where we're saying people, the doctor is not listening to me, or the physical therapist is just taking me through these things that I say are bothering my knees, or, I go on and go on. But when you show someone respect, you're showing that person attention and regarding that person's feelings. To show empathy, empathy is, how you would want to be treated as a patient or a client, or at least trying to empathize with what they're going through. So you may not think that, what a patient is going through is a very big deal. But for them, it potentially could be. And so you may not be able to recognize it personally, but if you empathize with them, what you do at least is recognize um, the issues that they're going through. And then dignity, you want to absolutely uphold dignity for your clients, which is that you're showing them regard. Um, an example of this would be if, let's say, you're a massage therapist and you're very careful about keeping draping. You drape them appropriately, and you're making sure that their body is not exposed or they're not uncomfortable in any way. That would be showing dignity. So seeing red is kind of a nice little, like I said, acronym that you can think about while you are working with a client. Standard of care. Standard of care is an important concept which refers to the attention given to a task that would be reasonably expected to be given to anyone in a similar situation. Standard of care is used in the legal system a lot. And so what can happen here? Let me give you another example. If you're showing someone standard of care, that would be that you're going to treat individuals the same regardless of their ability to pay. So, for example, some people have insurance, some people don't. There are some legal cases that have come to bear where individuals have said, I am not treated the same because I was uninsured. So you did not meet the standard of care. So that's why it's kind of more of a legal term oftentimes. But essentially what this means for us is that you should be treating people to the best of your ability and to the standard of care, no matter who they are. That's really important. Here's some guidelines. Here's a nice little checklist for you for a professional relationship. So trust is really important. Inappropriate language, not very professional. Non-judgment is a big one. Because you're going to be working with individuals about their health, there's going to be a lot of concern about judgment. And I can give you tons of examples, judgment about being overweight or, how they eat. I've had clients before that have, come to their appointments as a wellness coach. So when I was doing wellness coaching, and for dinner, they had literally an entire thing of an entire half gallon of ice cream. And, they don't want to be judged when they come to you for help. And so you really should listen to your patient first. Listen to what they're saying without judging. And when I say judging, I mean making like determinations about the quality of the person. They've obviously sought care because they want your help. That's what you should be focusing on, is then, okay, how can I help you change this behavior? Not judging the behavior itself. Be very careful about personal boundaries because you are working in healthcare. And oftentimes, I think the wellness coaching or personal training or physical therapy is a really important example. People are going to share things with you. They're going to share things that are very personal. Maybe they're having marital problems. Maybe they're having issues with their kids. Maybe someone they know is abusing drugs and they tell you that. And it's just really important that you keep things as professional as possible while still, of course, treating them with good bedside manner, if we're going to use that term. So just, again, more examples. If someone's telling you how bad their marriage is, probably best for you to not give opinions about what they should be doing in their marriage. You can listen. You can empathize, but you are not a marriage counselor. You are a personal trainer or you are a wellness coach. So you can, suggest help them getting other help, resources, but giving advice outside of your professional scope of practice is not okay. So you have to be very careful about those personal boundaries. Of course, no sexual contact. I hope that goes without saying, but especially this year, and with the Me Too movement, there's a lot of inappropriate behaviors that have come to light that we have known obviously for a long time have been an issue, but people are really starting to hopefully continue to recognize this behavior. And so even flirting and inappropriate comments, obviously, absolute no-no. When you're in healthcare, sometimes you may make home visits, and sometimes that's totally okay. If you're a personal trainer, there's some personal training businesses that their whole model is going to people's houses to train them. And that's okay, but you just must take precautions. And so I had a friend that used to do this. She was like a mobile personal trainer. As much as possible, she would actually do training out in the yard or out in the backyard, so she could minimize any risk at all. And obviously, you're never doing any kind of home visit for personal reasons. Finally, here's the last one. And this one's really important. You cannot or you should not make promises to a patient or a client that you can't keep. So you have to be very careful about this, and so if you have an individual who's going through cancer treatment and you're training them, you're doing personal training because exercise is fantastic for cancer patients who are even in treatment. Obviously, you have some considerations there, but it's really good for them. You can't make promises about how the treatment will end up, but you can say things like, I will be here with you no matter what. We have the best team available to tackle this head on. You have to be very careful because you don't want to make promises that you can't keep. Sure, you can be sued, but also someone will not trust you. If you go up to number 1 here, care is built on trust. If you make promises and then those don't happen, you are not going to really be a well-trusted professional. So keep these in mind. So let's go here to consent in care and in training settings. So consent, just like informed consent, is agreement to treatment, care, or training. And so consent, just like in research, it can be informed, which you should do, but also you can give consent by implying consent, which suggests compliance, which would be a good example of this would be a nurse comes in to give you the flu shot and you roll your sleeve up. That would be implied consent. It's not very strong. You want to always go with informed consent whenever you can. But there is such a thing as implied consent too, which means, you ask someone to do some squats and they do it. So, that suggests compliance. Excuse me. All states have some form of Good Samaritan law, which protects individuals from being sued who are acting in good faith. And so I'm sure you've heard of this. If you see someone in distress on the street and you try to help them, let's say things didn't go well, you can be protected under these Good Samaritan laws. Again, meaning that you would be not legally held liable if, for instance, you give someone CPR and you break a bone. You were acting in good faith to save someone's life, so you would be protected. Some states, though, have a duty to assist law, which means that if you are trained, you have to help. California is not one of those, but there are several states. So just again, if you are practicing as a professional somewhere, make sure you know all of these laws. Confidentiality absolutely has always been an ethical subject dating back to, as far as we know, Hippocrates, which is considered kind of, actually, physicians today still do the Hippocratic Oath when they graduate from med school. And in the Hippocratic Oath, it pretty much lays out that if whatever you see and hear in the course of treatment or outside of treatment in regards to the life of men, you'll keep it to yourself. And that's important. It goes back to trust. It goes back to, ethical behavior. And so confidentiality, make sure you are keeping what we would call professional silence. So you're going to keep that personal information private. why they sought treatment in the first place. And actually, we're going to talk about this a little later, but we do actually have laws that protects individuals' private information. So it is mandated by law. Here they are. So federal protection laws. In 1974, we had the Privacy Act. And the Privacy Act of 1974 actually, it's considered kind of the forefather to our Protection Act today. But the Privacy Act covered a lot of personal records, including non-medical records. And then in 1996, we actually had the passage of HIPAA. You've probably heard of this because you have to sign forms every year if you go to a physician or any other kind of medical provider, and you have to agree to these terms. So Title II of HIPAA, so HIPAA obviously standing for Health Insurance Portability and Accountability Act, it does a couple of different things. But Title II of HIPAA actually is the portion of it that sets the policies, procedures, and guidelines for maintaining privacy and security of individually identifiable health information, which includes accessing that information, storing that information, and giving that information to somebody else or transmitting data. So for example, a nurse can give you, so let's say you went and got some blood draw done, you got some results. A nurse can give you the test results for that service, but they cannot, and it is unlawful for them to share with somebody else without written authorization from you. So you, as the patient, have to write down who else can receive your health information. And I always put like my spouse on there because in case, a physician calls and I'm not home or whatever it is, that my spouse can have that information. Some of you may have your parents. And so you can write anybody there, but you have to have written authorization from you for that person to receive that information. And if they share information with someone else other than you, that is against the law. You have lots of forms. And that's why I said you're probably familiar with these because you probably had to sign them on an annual basis as you go in for medical services. So you have a privacy notice. You have a signature indicating that you've received the privacy notice. That form, I said, if you want to provide names of other individuals, and then a couple of other things here. So you've got all these different forms. You don't have to know these different forms, but I just wanted to, because I know you probably had experience with some of these, this is why. It's laid out in this federal law. So that was 1996. So the privacy rule in 2001 is a portion of HIPAA that now refers to what we call protected health information. So HIPAA covers everything pretty much that can be identified or that can be personally identifiable, which includes your name, your birth date, your social security number, your address, whatever it might be. Your insurance company can obtain that information if you release that information, and you often do. However, there are some exceptions. So if you're a professional, you may report abuse. If you have volunteered for medical research, your health information may be obtained. Of course, that's with your permission, though. And certain contagious diseases. So if you have, if you get tested for HIV and it's positive, that gets sent to the health department, the county health department. Tuberculosis. There's a long list, actually. And some of them you'll be surprised about. E. coli and salmonella, that gets reported to the health department. And the reason why is because they want to stop any potential spread of contagious diseases. So there are some exceptions to this privacy rule, but they're pretty narrow. I mean, it's really just these, abuse and contagious disease areas. HIPAA, though, is really medical records. So it doesn't cover financial documents, educational records. These are all different laws, actually. So you have, educational records protected under another law. You can have medical records still subpoenaed for court cases, and so on and so forth. So there are some other laws that cover some of these things, not HIPAA itself. HIPAA is that personally identifiable health information. When you breach confidentiality, that means you violate it, and you may have heard of this, breaches of confidentiality. Common breaches include asking why they're seeking care in public, so meaning they walk up to the counter and you say, hey, why are you here? Why are we seeing you today? It's actually kind of, no one really wants to tell people in public, why they're at the doctor's office sometimes. A sign-in sheet, remember, names, birthdays, social security numbers, addresses, phone numbers, all of that is protected information. So having a sign-in sheet is actually a breach of confidentiality. Conversations between medical professionals that's not happening in a private environment, leaving computers on and logged in are common breaches of confidentiality. So all of these things definitely you need to be paying attention to as you work in a healthcare providing facility. And that includes gyms, right? All of this information, personal trainers, strength and conditioning coaches have. And so you actually have to follow. This is not just physician or physical therapist thing. HIPAA applies to any information that can be covered. So like I said, personal trainers and strength and conditioning coaches and wellness coaches, you have to follow HIPAA. So how can you achieve confidentiality? Well, in two main kind of bullet points: professional silence, so not saying anything. I know that sounds simple, but sometimes, you think something's not a big deal and you share something out in the open and it might be a big deal. And then, of course, secure data management. And that does mean, locked files, logging out of your computer, making sure your security stuff is updated on your computer to the best of your ability, and or having the company help you with that. If you have an IT department, making sure that your computer is secure. So making sure all of these things are in place, and then, of course, not saying anything. So one more law here. Patient Safety and Quality Improvement Act of 2005. If you feel like there is some violation of patient safety, reporters are protected, right? Sometimes people are called whistleblowers, but you are protected if you want to report anything that you see. Oftentimes what will happen is that you'll go through some kind of training when you get brought on to, let's say, a hospital or a clinic or whatever it might be, and they will walk you through all of these things. And then finally, I mentioned this already, but there are exceptions to confidentiality in healthcare. And oftentimes these are what we would call mandatory reporting laws. So you have mandatory reporting laws in all states. And in California, you're a mandated reporter if you work in pretty much any place that has people. So schools, hospitals, so on and so forth. And so you are a mandated reporter. You have to report, not just you should, but you have to report things like suspected abuse, child abuse, elder abuse, spousal abuse, or other domestic violence. There are other exceptions where you can be protected in healthcare. So let's say you do have some individual who you think could become violent and or harm others. You would be protected in letting authorities know of your concerns. So there are some exceptions to that. And like I said, with mandated reporting laws, you may be required to do that. Okay, so there's a lot of information, I know, a lot of different things to think about. So it is important for you to, of course, also be reading the textbook. And as well as those additional readings for this section, and come back and think about some of these things. But what we're talking about here is really, now that we have these laws and these codes of conduct, what does that mean? And so that means, how do we actually practice, and how do we research ethically? So that's what today was all about. If you have any questions, as always, get a hold of me, and have a good one.